Okay, so the idea now is to talk about the interesting disease or phenomena called the Brown, and look how it is written, Sequard syndrome. And it is a syndrome. It is a constellation of symptoms that can be caused from different things. And let's look at what it causes. So the main idea is that if you look at the spinal cord, I'm not sure I'm doing it the most right way, there is a lesion or something or trauma to one side of the spinal cord. This is the spinal cord. So only one side is damaged. Different things can cause it. So if we're looking at the causes of what can cause one-sided lesion in the spinal cord, things like trauma, things like tumors, things like infections or inflammations, both are INF. I don't know, like multiple sclerosis, tuberculosis. So multiple sclerosis if it causes a lesion in one side of the spinal cord, and another cause that can be is ischemia. So all of this, for example, can cause one-sided lesion. And now the very interesting things about this syndrome is the symptoms of the disease. So what are the symptoms? There are ipsilateral and there are contralateral symptoms, and it is based on which tracts are damaged from one-sided spinal cord lesion. And it is very interesting because you need to understand the neuroanatomy in order to understand why it caused this lesion. So if I have one-sided lesion, what are the things that are damaged? So of course, one thing is motor damage, but not only motor, but also proprioception. This is in the ipsilateral side. In the contralateral side, what we can see is pain and temperature. Pain and temperature. Namely, the person will say or will present with motor weakness or even paralysis in one side, coming with proprioception, like he doesn't know where his end is in this side. But in the contralateral side, he won't have pain or temperature. And why is it? Now, the motor component comes from which tracts? So motor comes from the corticospinal tract. Now, the corticospinal tract only cross over in the brainstem. Therefore, they are going up, and only when you are getting into the brainstem, if I can even show you this here I have the spinal cord. Now, if I'm looking in the corticospinal tract, it will cross over to the second side, to the contralateral side, only when it gets to the brain, but here, only in the brainstem. Now, also, if you think about the proprioception and fine touch, it is in the dorsal columns. But this is the corticospinal tract. Now this is for proprioception and fine touch. Again, it transmits sensation from the ipsilateral side, from the same side of the body. So again, this will hurt those tracts. So we will have a lesion in one side, and the corticospinal tract and the proprioception and fine touch, all of this will be also damaged. Now, in contrary to this, the spinothalamic tract cross at the same level. The spinothalamic tract enter the spinal cord and then cross spinothalamic tract. It crosses at the same level, so damage here will make a difference in the contralateral side. So, but the spinothalamic tract transverse temperature and pain, which comes from the contralateral side. And corticospinal tract give us the motor component. So this is the constellation, the interesting constellation of the Bernard-Soulier Brown-Sequard syndrome. This is the constellation that is very neuroanatomy, if you want to think about it. Now, the diagnosis, as you can understand, is quite clinical, but MRI can show us what is the cause of this. I mean, you will see someone with this constellation, motor weakness, ipsilateral, proprioception, ipsilateral, fine touch, ipsilateral, but contralateral pain and temperature from the spinothalamic tract will be damaged. This is the syndrome which we can look for the cause throughout, for example, imaging, or use the story of the disease, for example, I don't know, trauma or multiple sclerosis, something that tells us what is the cause. So MRI can look for the cause, for the lesion that caused it. Now, the treatment depends on what the cause is. If it's infection, for example, I don't know, tuberculosis, so antibiotics is the way to go. But if it's a tumor, we will need here surgery. So if we're thinking about treatment, it depends on the cause. And if you know the cause, you know the treatment. Again, surgery for trauma, antibiotics for infection, I don't know, for multiple sclerosis, give steroids or immunosuppression or whatever you want to give for multiple sclerosis. So based on the cause is the treatment, but the syndrome is this constellation of symptoms which comes from the ipsilateral lesion to the spinal cord, and understanding the way the corticospinal tract and the spinothalamic tract and the proprioception and fine touch, which comes from the dorsal columns, cross where they cross in the, let's say, central nervous system. Let's say that this comes from the dorsal columns, which are right over here. Okay, and corticospinal tract, which make motor. So I think they are right over there. Okay, so Bernard-Sequard give me lesion in one side of the spinal cord and give me this constellation. Thank you very much. If there are any mistakes or correction, please tell me. And Bernard-Sequard syndrome, that's it.